2 of this 3-day virtual event with Plenary Session 3 themed Responses of African Countries to COVID-19 and Social Protection. A couple of reminders before we kick off the session. Please, we are providing translation for this meeting. If you need the interpretation services, click on the icon on your screen. You can choose to mute the original audio if you so desire. Also, join the conversation on social media with either of our hashtags #2021 Resites and #2021 ATOR. Now we are all set, and I'm going to hand over to the chair of Plenary Session 3. He is a visiting researcher at Imperial College London. He is also a member of the Malabo Montpellier panel, and he is Dr. Debisi Araba. Mr. Chair of Plenary Session 3, the floor is yours.
Thank you very much, Dr. Batake. Thank you, Lai. Hello everyone, depending on where you are joining us from around the world. It is with great pleasure that we welcome you to day 2 of the RESACS conference. I would like to introduce Ms. Tissy Makombe, the Director, Department of External Relations, Academia 2063, to give us a recap of day 1, as well as the program in store for everyone participating in day 2. Sissy, you have the floor.
Thank you very much, Mr. Chair. I hope everybody can see my screen. So good morning and good afternoon, ladies and gentlemen. As the chair has said, I'm Tissy Makombe, and I work as the Director of External Relations at Academia 2063. So I am going to give you a recap of the first day of the 2021 RESACS Annual Conference and also run through today's program. But before I give you a recap, I'll just briefly go through the objectives of why we are meeting. One key objective for this conference is for us to discuss the research evidence and recommendations that are presented in the 2021 Annual Trends and Outlook report that we launched yesterday. The report looks at the impacts of the COVID-19 pandemic on African economies and food systems. It looks at policy responses as well as options for building the resilience of food systems. Another key objective for us is to examine measurement as well as methodological issues that are related to assessing vulnerability and resilience to crises and shocks. Another objective is for us to identify required actions for rebuilding Africa's food systems following COVID-19. Today, we are going to focus on the first 3 sets of objectives, and tomorrow we'll focus on the last 2, which are: 1, to assess progress in promoting mutual accountability through the CAADP biennial review process. And the last objective is to evaluate the status of CAADP implementation and progress towards achieving key goals and targets. So with that, I'll move on to giving you a recap of what happened yesterday on the first day of the conference. We had the official opening of the 2021 conference with some featured high-level speakers, including our very own Dr. Ousmane Badiane, the Executive Chairperson of Academia 2063. Dr. Badiane stressed the need for us to learn from the unprecedented COVID-19 shock so that we can withstand shocks and learn what to do better. Another key speaker was Ms. Maura Barry, who's the Senior Deputy Assistant Administrator at USAID. Ms. Barry noted the importance of addressing climate change to ensure resilient food systems. She also gave us examples of various initiatives that the US government is involved in to address climate adaptation, including what's called the Comprehensive Africa Climate Change Initiative, CACI, which was recently launched at COP26 by USAID together with the African Union Commission. Last but not least, Her Excellency Ambassador Josepha Sako officially opened the conference. This is the commissioner at the African Union Commission's Department for Agriculture, Rural Development, Blue Economy and Sustainable Environment. In her remarks, she noted how she looks forward to learning how strategies coming out of this conference on how to build resilient food systems will speak to the Africa Common Position paper that AUC recently launched at the UN Food Systems Summit. We then had a very compelling keynote presentation by Dr. Maximo Torero, the chief economist at FAO. Dr. Torero went through the current situation in Africa due to COVID, where we are seeing rising levels of undernourishment, rising inequality, lower real incomes. The good news is that Dr. Torero did highlight what we can do about all this, which is really through increasing the resilience of Africa's food systems. This will require investing in early warning systems, increasing access to agricultural insurance to minimize risks, as well as to invest in social protection technologies, as well as to boost the productivity of farmers. We also were given an overview of the chapters in the 2021 ATO by one of the co-editors, Dr. Elaine Obalijoro. She went through the chapters in the report and highlighted some of the key messages coming out of the report, which include enhancing social protection programs, ensuring well-functioning markets, enhancing data indicators and methodologies to help us better understand the impacts of shocks as well as resilience to shocks. Following these presentations, we then had a very engaging high-level panel discussion with representatives from FAO, AUC, the African Development Bank, as well as the Southern Africa Confederation of Agricultural Unions. The panelists noted the vulnerability of Africa's food systems and highlighted that a systems-level approach is required to addressing these vulnerabilities, including applying multi-sectoral and multi-stakeholder approaches. Panelists noted the importance of also paying attention to institutional resilience, including learning from successful institutional innovation models that have worked in other countries, the need to align policy incentives with objectives, also the importance of having consistency in policies at the country, regional, and continental levels. Also, the need to involve farmers in designing of response measures that are meant for them was noted, as well as we're reminded that no one-size-fits-all strategies will work. We then moved into the second plenary session yesterday that looked at the impacts of COVID-19. Here, there were presentations of 3 chapters in the report, 1 chapter on the impact of COVID-19 on agricultural commodity prices, with really emphasizing the importance of location. As, for example, changes in staple food prices can vary by whether we're looking at deficit or surplus areas or looking at landlocked areas or coastal areas and so on. We also had a presentation of a chapter on COVID-19 induced food trade disruptions and poverty in Africa. This chapter really noted the importance of Africa having more diversified export baskets, as then that can increase the resilience of Africa, of Africa's food systems to shocks. There was also a presentation of a chapter that assesses the vulnerability of African countries to COVID-19. This chapter really emphasized the need to look at household level and location vulnerability, especially at the subnational level, as sometimes looking things at the national level can really miss out on some of the nuances which can allow us for better targeting of response measures. We then had yet another engaging panel discussion where panelists responded to what had been presented in those chapters. The panelists, including representatives from the African Continental Free Trade Area Secretariat, from the Global Alliance for Improved Nutrition, and we had representatives from the government of Malawi and from the Southern Africa Development Community. The representatives from Malawi and SADC, they noted some of the measures that their countries and regions had taken in response to COVID-19, including social protection, cash transfers. At the regional level, they even put together regional guidelines to help keep borders open. And I know the representatives from the CFTA Secretary really emphasized the need for African Union member states to do what he called front-load agriculture in their tariff reduction schedules as really one critical way of promoting intra-African trade. The importance of also promoting local healthy foods was also emphasized during these discussions. Next, I'll run through our program for today. So as right now we're in plenary session 3, which is looking at responses of African countries to COVID-19 as well as social protection. We are going to have presentations of 4 chapters in the report that look at responses. Each chapter will be presented for 10 minutes. This will then be followed by a panel discussion where panelists will share their perspectives on responses of African countries. And that panel discussion will go on for about 30 minutes. We'll then open up the floor for participants, for all of you to have an opportunity to ask both panelists and the presenters questions that you may have. So that also take about 30 minutes. Following this, that third plenary, we'll have a break of about 5 minutes and then move into the last plenary of the day, which is plenary session 4, that will look at measurement issues around data and indicators. Here again, we'll have presentations of 4 chapters in the report that cover these issues. Each presentation will be for 10 minutes. This again will be followed by a panel discussion with panelists sharing their perspectives on issues of data, measurement, and methodologies for measuring resilience. Lastly, we'll open up the floor again for you to have a chance to ask panelists and presenters your questions. Before I conclude, I just wanted to remind you, we did launch the 2021 ATO Annual Trends and Outlook report yesterday. It's now available online, both the full report and individual chapters. You can find them on our conference website as well as the RISAC's website. We also have all the presentations you're going to be hearing throughout the conference. We'll make them available on our RISAC SlideShare website soon after the conference. We encourage you to stay engaged and share deliberations on the conference and your views on social media using the hashtag 2021 ATO and 2021 RISACs. With that, thank you very much, and I'll hand it back to the chair.
Thank you very much, Ms. Makombe. As has been mentioned, ladies and gentlemen, this is plenary session 3 of the RISACs conference. The title of this session is Responses of African Countries to COVID-19 and Social Protection. We will now go to a list. I will now invite a list of speakers to present their keynote presentations. They will have about 10 minutes each. We will begin with Dr. Jan Dukoslav, who is a research fellow at the International Food Policy Research Institute, IFPRI, which is part of the 1CG body, to present on the delivery of social protection programs to combat COVID-19 in Africa. Dr. Dukoslav, you have the floor.
Good morning, good afternoon. Can you see my screen?
Yes, we can. Please carry on.
Wonderful. Thank you very much. So I'll be talking about chapter 7 in the report, which I put together with Dr. Kalle Hirvonen, who's also at the International Food Policy Research Institute. Kalle is based, or was until very recently, in Ethiopia, and I'm with the Malawi program of IFPRI, based in Lilongwe. And so we look at how social protection programs in Africa, how governments were able to use them to address issues arising from the COVID pandemic and from the related restrictive measures that in many places were put in place. Now, to give a brief overview of social protection in Africa, social protection programs are a common policy tool to address poverty and food insecurity, and have been for a while, and are getting much more prominence recently in the African context. But because they generally try to address poverty and food insecurity, which tends to be much more prevalent in rural areas, that is where they tend to be focused on most social protection programs. Now, the situation with the COVID-19 pandemic is slightly different from the regular income shocks and chronic food insecurity that most programs deal with. And it is different in the sense that COVID-19 disproportionately tends to affect the service and industrial sectors, and those of course are mostly concentrated in urban areas. So this means that existing social protection programs often are ill-suited to respond to COVID-19 because they essentially target the wrong people, or target the people who may not be the ones who are most severely affected by either COVID-19 itself or more generally the measures that governments put in place to limit the spread of the pandemic. This means that many governments in Africa have either adjusted existing social protection programs or even put in place new ones. And we try to present some initial evidence as to how this worked so far, or in the first year of the pandemic. Most of the analysis looks at the year ending in March 2021. So how did social protection work during the pandemic in Africa? As I mentioned, most social protection programs tend to be designed to protect against chronic poverty, against income shocks, etc. Now, the shocks that come out of the COVID-19 pandemic are much more multifaceted in general. The pandemic affects health. Health outcomes, it affects income, food system, it affects the logistics that bring food to urban areas, but also the logistics of social protection delivery. So the big question is, are social protection programs still effective in countering the negative effects of the pandemic? And to that end, there is so far rather limited evidence, but also quite encouraging evidence. We have seen in studies in Kenya that universal basic income that was provided to a small population there actually did improve both food security and physical as well as mental health in people who receive the support as compared to a control group. We also see that cash transfers that were provided to owners of micro enterprises improved the performance of the micro enterprise, which meant that cash flows remained higher. There was less need to deplete stocks and to deplete assets. So also some positive impacts there. In Ethiopia, where the productive safety net program, which the government has been running for a while and which many people will be familiar with, their households that participated in the PSNP were more secure, more food secure in the face of the pandemic than those who did not. And we see also elsewhere outside of the continent that various forms of cash transfers increased food security. They decreased the need for asset depletion, and therefore decreased the need for essentially the negative impact of the pandemic on poverty. So it seems that social protection programs can actually help governments face the negative impact of the COVID-19 pandemic. Now, in order for this to actually work for the right people, the social protection programs need to be targeted at the right people. So we looked at a few case studies of that, and in the absence of a measure, of a readily available measure of who actually is most impacted by the pandemic, I think it's fairly safe to assume that that poorer people tend to be more vulnerable to the negative impacts of COVID-19. So we looked at high-frequency phone survey data from the World Bank, looking at who in the year ending at the end of February 2021, actually, so from the first year of the pandemic, effectively, which people were receiving support from social protection programs. And here on the screen, you see sort of two extremes that we find on the continent. One, in the case of Ethiopia, where social protection programs, both the flagship PSNP and social protection in general, are fairly well progressively targeted, so that the poorest people, what you see on the horizontal axis, are wealth quintiles, and you can clearly see that the poorest quintile, people in the poorest quintile, are much more likely to receive support from social protection programs than people who are better off. On the other hand, in Nigeria, on the right hand side, in urban areas, there does not seem to be much targeting in terms of wealth at all, and in rural areas, actually, it would seem that wealthier households were much more likely to receive support from social protection programs than poorer households. So obviously, there is space for improvement, and as I said, these are sort of the two extremes. Many other countries fall somewhere in between in terms of how successfully they can target their social protection programs. One such country is Malawi, which is our third case study, and on which I would like to demonstrate or illustrate another area in which there is a lot of room for improvement, and that is the effectiveness of the delivery of the programs and sort of their logistics and organization. What you see on this timeline here is the blue line is a 7-day moving average of new COVID-19 cases starting on the 1st of March last year and ending at the end of February this year, so the first year of the pandemic. The red bubbles show point to dates in which measures were put in place that effectively put some kind of burden on most households, so such as school closures, limitations to public transports, etc. On the other hand, in green, those are measures that should relieve some of that strain. So things from the schools reopening, or reductions in fuel prices, or the one that I would like to draw your attention to, and that is an introduction of an urban cash transfer program. And that was put in place what would look like, in the middle of the second and the strongest wave of the pandemic, at the beginning of February 2021. And that would seem to be quite timely. And very much needed, because of course the existing cash transfer program mostly was targeting rural households. Now, this looks timely until one looks at it a bit more closely and realizes that the program was actually announced even prior to the first wave. So shortly after the first restrictive measures were put in place at the end of April 2020. It did not get funded until after the first COVID wave at the end of October 2020, and then effectively put in place when already the second wave was subsiding. So there were huge challenges in putting the program in place, and that's a third point where where existing programs or new programs and their delivery seems to be lacking timely implementation. So to conclude, we see from previous evidence on social protection in general, that it is very effective in improving food security and in protecting assets, so essentially preventing people from falling into poverty. There is thin evidence that of effectiveness of social protection programs during the pandemic as well, and to that effect, existing and new social protection programs are being used to counter pandemic effects in Africa. But there is some room for improvement, both in terms of the coverage, as you could see from from the targeting charts. Even the poorest households, who tend to be the most vulnerable, most of them still are not receiving any assistance. There's also room for improvement in terms of targeting. In many places, the targeting of social protection programs is very ineffective. And there's room for improvement in terms of implementation, whereby new programs and the adjustment of existing ones takes time and faces many logistical challenges. And I think there will be another presentation talking about some of these things in 10 minutes time. And with this, I would like to thank you for your attention and turn this back to the moderator. Thank you very much.
Well, thank you very much, Dr. Dukoslav. Thank you, Jan. So that was a very broad presentation looking at the two spikes, with the last slides looking at the two spikes in Kenya, and seeing how the program was funded at the point of inception, the funding and implementation, and the impacts that had on delivery. Our next speaker is Dr. Gitau Tadesse. He's the Director, Department of Operational Support in Academia 2063, and his presentation will be on assessing African economic policy responses against COVID-19. Dr. Tadesse, are you ready?
Yes, thank you, Mr. Chairman.
The floor is yours.
Okay, thank you. Can you see my screen?
Yes, we can. Please carry on.
Okay, thank you. My name is Gitau Tadesse. I work for the Academia, and today I will be presenting on the assessing African economic policy response to COVID-19, which we wrote together with my friend from Academia, Undoson Tafarra, who is a senior associate scientist. And my presentation, the chapter 6, the objective is just to look at the sectoral policy responses. And as you know, there are a lot of policy response, COVID-19 policy response trackers, including the IMF, the IFPRI ones, the export ones, and all these things. And they have tracked, cash transfers and also macroeconomic responses, all these things. But unlike those things, we just try to track the response of some countries in Africa, specifically on 4 sectors, in terms of in-kind transfers and as well as in terms of regulations. And we will also try to, see the implementation performance. So what matters is the implementation in terms of effectiveness and targeting and all these things. And we also looked at the association between the policy response and development outcomes, specifically on food price stabilization, because the aim of all this response is just to protect consumers and producers from price shocks and all these things as a result of COVID-19. And then we identified some best practice that may help for improving implementation performance. So with regard to the sectoral policy response, what we do is we just interviewed some experts from 17 African countries, which covers all the regions, the southern, the eastern, the western regions in the sub-Saharan Africans. And we just had an interview with some experts, key experts who knows the sectors better. And we have asked a lot of questions. And then based on those questions, we collected some scores. So the first score is the sector policy response score for food, seed, fertilizer, and trade sectors. So this score has been developed based on the number of responses. And the number of responses, when I say, means both regulatory responses and also transfers, cash transfers, in-kind transfers, and all these things. And also we scored this based on the timing of the response. I mean, based on the timing of the response, both against the case loads and also just absolute numbers, I mean, in terms of dates of response that the policy has been made. So the result is just presented in these graphs for different countries and for the different sectors. And the results show that the response varies across sectors, and only 3 countries didn't respond in food sector, for example, because unlike many other responses, I mean, many of the African countries, they have responded for all the sectors. Only few countries, they didn't do it. And actually this response is just, we collected from March 1, 2020 up to February 2021. So for 1 year. And 8 countries responded in all the four sectors that we have considered. So this means that even if they are not, the African countries may not be responsive in terms of macroeconomic response and also cash transfers, but they do also respond in different sectors and also in-kind supports. And also we looked at the program implementation performance score. So what we do is we just develop a score for the different sectors in different countries based on targeting effectiveness, speed of implementation, I mean, relative to containment for food transfers, and relative to planting time for seed and fertilizers, and also the institutional coordination, whether the country has organized task force or not, and there are other institutional arrangements for implementing, and also the use of digital technology. As we know, this COVID-19 has made mobility restrictive. So digital technology has been the ones that have been promoted for implementing the response. And we also looked at the use of digital technology, both for the delivery of the transfers and also for monitoring and evaluating the system of those responses. And then now the results showed that only 6 countries have an average score of more than 70% for each sector. And we see varying implementation performance. And many of them, they don't use this digital technologies. Only a few countries that have applied these digital platforms, including, voucher systems and all these things. But when we compare across sectors, we realize that input response are implemented better than the other sectors from trade and food sectors. And then we looked at the association between the implementation performance and the response with that of the price, the policy, the price stabilization. So I think we did some price volatility estimation based on the actual happening and based on also a simulation that's expected if COVID-19 were not implemented. I think this has been presented yesterday. And then we looked at the for 4 countries for which we have data. And if you look at the volatility index and the volatility index and also the performance of this policy, for example, for the 2 countries, Malawi and Mozambique, we have very low performance scores. And then the price volatility index, the absolute value, is very high. But for Burkina Faso and Kenya, where we have better score in terms of implementation and responses, we have very low volatilities. This means that not only the response, but also the implementation of the programs are really important to impact on the development outcomes. This is just an example for food price stabilization, but it might have also significant effect on other development outcomes, including food securities and all these things. So then we try to see what contributes for the improvement of implementation performance. And then we did some principal component analysis to identify which factors are more important for improving the implementation score and all these things. And then what we did is we first identify best performing countries, and then based on that we characterize these countries, whether this country how they perform in terms of different policy options, such as the use of multiple instruments and the targetings and the use of stocks and market-based responses, the use of task force digital systems, and all these things. Based on this evaluation, what we realized is generally best policy options varies across sectors, because what's maybe best for food sector may not be best for for seed and fertilizers. So if you look at the higher the percentage here means the best that's the best policy option that matters for improving the overall performance of implementations. So generally, the use of multiple instruments such as transfers and regulations, and also the use of task force help us to improve the overall emergency response performance scores. So these are some of the ideas that we brought up from our analysis. And then based on this analysis, we try to see the implication for policy and research. And in terms of policy, the need to align emergency policy response with the nature of the risks and sectors. That means, I mean, some of the risks like the COVID-19, which is global, and also it restricts movement of goods and service, unlike the ones we know in Africa, such as droughts and all these things. So this might have a different way of approach than dealing with the usual emergency risks in Africa. And also the use of multiple instruments and innovative implementation process might be more important. It's more important for this type of risk. I mean, the type of risk matters for the type of responses and implementations. And in terms of research, I think we did some very qualitative assessment of how countries respond and how effective are these responses and how they impact intervention, but more quantitative and more in-depth analysis based on the increased number of countries might be needed to better understand the implementation performance and also identify innovative approach that can be scaled up across countries. So with this concluding remarks, I just wind up my presentation here. Thank you, Mr. Chairman.
Well, thank you very much, Ital. That was an enlightening presentation, and we've seen the implications. Our next presentation moving along will be from Dr. Benjamin Davis, who is the Director, Inclusive Rural Transformation and Gender Equality at the UN Food and Agriculture Organization. And his presentation will be on rethinking the role of social protection in Africa food systems. I guess you're starting to see the common thread in all the presentations now. Benjamin, the floor is yours. Can you set your presentation to presentation mode?
That's what I'm trying to do. Oh, wait, oh, there we go. How's that?
All right, that's perfect. Thank you.
Great. No, well, thank you very much for the introduction, and it's an honor to be here. This is very much a companion piece, let's say, to the presentation that was given by John, taking a somewhat, let's say, broader, higher level, more future-looking perspective, maybe some of the lessons that we learned from the social protection response. No, this is a product of the colleagues from the social protection team here at FAO headquarters in Rome. Maybe just to give the, hold on one second here. I'm trying to move this, there we go. Just to give the punchline for the chapter, and what we do is we use a food systems lens, focusing on food system actors to look at the response to the impact of the response of the COVID-19 crisis. We focus on social protection, and we look at the emerging evidence on the impacts of the crisis. I think our conclusion, and this follows on what John was saying, is that the response has been insufficient. Even though it's been significant, it's been insufficient to stem widespread impact on food systems in rural spaces in the region. And that really leads to an urgent need to strengthen, reconceptualize, and redesign social protection systems to support more effective and inclusive post-pandemic recovery efforts. And really the opportunity to use social protection systems to leverage building back better and strengthen the resilience of African food systems. So we use this food systems lens. We focused on 4 actors within the food system. First would be farm laborers, who are overwhelmingly informal, seasonal, often very much family labor, strong role played by women. The wage laborers in particular are usually the poorest of the poor in the rural space, often landless or functionally landless, with limited access to development interventions. And this high level of informality limits access to any social insurance, unemployment benefits, if they exist in a country. A second group is our primary producers, which is it's a heterogeneous group, often with diversified livelihoods, often obviously overlapping with the farm labor category. The majority are resource constrained, depend on rain-fed agriculture in a context of increasing climate change variability. They have a lack of access to formal instruments to manage risks, and production is often oriented more towards subsistence than to maximizing profits, although most are linked to markets. Also very important are the intermediaries within the food system. And here it's small and medium scale agricultural traders, food processors, input and service providers, and food retailers, which is, again, it's a critical source of non-farm employment, often 20% in most contexts in rural areas of the region. Overwhelmingly small scale, unregistered, self-employed, informal still. And they're also highly mobile, right? Where you have aggregators and wholesalers consolidating a whole myriad of small scale transaction and small scale agents and linking to markets. And then finally, consumers. And again, we have persistently high levels of food and nutrition insecurity, with particularly high levels in rural areas. Now, we just to bring in the kind of, let's say, the multidimensional role of social protection, and I think this responds to a question I saw in the question box. And really, there's 4 roles that social protection plays. Certainly protective in terms of providing relief from deprivation, but also preventative in terms of averting deprivation in the first place. But also, and I think very important within the context of COVID and building back, promotive, and in terms of enhancing incomes and productive capabilities, as well as transformational in terms of fostering social and economic inclusion and inequality. And this is key when we look at food systems, the food systems paradigm, food systems transformation, and how are we going to get to a more inclusive process of food systems transformation. Social protection itself is usually made up of 3 kinds of programs: social assistance, safety nets, social insurance, as well as labor market interventions. And I think there's a whole body, some referred to by John, a whole body of evidence from rural areas in sub-Saharan Africa prior to COVID, which shows that social protection protects incomes and consumption, as well as has positive impacts on household level production, agriculture production, livelihoods, investments, as well as local economies, okay? And it's important to bring this out because it's not just a humanitarian short-term intervention. It also has a fundamental role in terms of rural livelihoods. It does this through relaxing liquidity constraints, as well as reducing the consumption risks that may be associated with making productive, future-looking investments. Now, these household level impacts, the transfers themselves or the social protection programs, as well as the impact they may have on households, it ripples through local economies, generating multiplier benefits, right? And this is important to keep in mind, particularly in the context of COVID-19, with governments looking to mitigate the short-term welfare losses, as we've seen, but also looking forward to future recovery efforts. We got a little taste from John's presentation in terms of the social protection response, and I think it's important to point out that there has been a growing prominence of social protection in the region. Almost or all countries in the region have some kind of social safety net program, at least. But I think the key point is that coverage is still inadequate. This data is a little old already, but as of 2016, over 70% of the poorest income quintile still didn't have any access to social protection. A very small percentage of Africa's children were covered by some kind of social protection program. But of course, there's large heterogeneity in coverage between countries in coverage. with some having reached universal coverage or almost universal coverage, particularly in Southern Africa or Ethiopia, etc., and others with very small programs. I think the point, and I think the point is that despite this progress in recent decades, most social protection systems in the region were poorly positioned to respond to a crisis of the magnitude of COVID-19. And the response that was there, as we saw, was primarily around social assistance, and as we can see in the graph, and of limited duration, as we can see here. Most were just short-term payments. I think this is a key point, and I think when we look at the impact the social protection programs have had, and in terms of protecting from the impact of the pandemic, looking at inter-regional differences, we see those countries which had stronger social protection systems in the first place. For example, Latin America, we can see the social protection programs have had a much stronger impact, let's say, in keeping households out of poverty from COVID, compared to those that don't have the such strong systems of social protection. What we find when we look at the impact of COVID in the region, when we look at through this lens of food systems and food system actors, is that there's been very substantial and likely long-lasting adverse impacts on the agri-food system and the livelihoods that depend on it. Again, this is a combination of the somewhat limited social protection response combined with the high vulnerability of those food system actors. Now, we cite a lot of evidence in the paper looking at how the livelihoods of rural people have been upended. So it's had obviously big impacts in urban areas, but it's also had very significant impacts in rural areas, with the majority of rural households being affected in terms of income. And these negative income shocks can be seen through multiple livelihood channels, because as we know, most of the rural poor have multivalent livelihoods. And this includes through agricultural income, non-farm business, wages, as well as remittances. This has all led to negative coping strategies with potentially long-term consequences, whether it's taking children out of school, whether it's selling off assets in order to be able to eat, and whether it's changing productive systems in order to maximize survival. As we've seen, it's also led to an increase in food insecurity and malnutrition in the region. But as we also saw in John's presentation, there is emerging evidence from the region that shows that that adequate social protection can offset these food security impacts of the pandemic. Okay. So finally, the conclusion we draw from in the paper is how we can use social protection going into the future as part of let's say, a multidimensional policy response to COVID and building back better. Social assistance, I think in particular, has shown to be very flexible and relatively low cost mechanism to reach many of the informal actors that constitute African food systems. And they can also, I think the evidence demonstrates pre-COVID certainly, that they can play a vital role in supporting the recovery of rural livelihoods and economies, particularly in managing risk at the household level and providing liquidity. We think there's 4 ways in which social protection programs can be made more responsive to shocks and contribute to the recovery and economic development of African food systems. The first is reconceptualizing the role of social protection as more than a safety net and humanitarian tool. And this gets directly to the question that was in the question box. When it's predictable and well-targeted, it can support households in engaging in new economic activities and managing their ongoing economic activities. It's important that there's better integration into development frameworks in terms of rural development policies, agri-food system policies, important greater coordination and coherence with private sector development and activities. And I think the recovery efforts under COVID-19 provide a unique opportunity in order to make this happen. Second, it also requires expanding coverage to reach a larger share of vulnerable rural populations, as well as very specific productive or food system actors populations, which again has to do with changing some of the targeting criteria, and also, of course, more resources. I think importantly, looking to the future, it's being able to respond better through strengthening social protection systems before the crisis, let's say. And that includes digitalization, legal frameworks, improved modalities for identification of beneficiaries, et cetera, all those things that one needs in order to strengthen the ability of a system to respond to changing conditions. And then finally, of course, it's always the key issue of the availability of more financing, both internally, domestic, as well as cooperation. And with that, I'll stop. Thank you very much.
Well, thank you very much, Dr. Benjamin Davis. They say that the best time to plant a tree was yesterday. The next best time is now. The other thing, of course, is that there's a famous proverb that goes, the youth sit under the shades of trees because the wise old elders planted those trees. So definitely social protection is important, and I don't think we should be waiting either for the end of what is now a global pandemic or until the next global shock before we do something about it. Now is the time to start, and it's never too late to start a social protection program. Thank you very much for your intervention. Our next speaker is Dr. Ebenezer Kofi. He's an assistant professor, Food System Sustainability and Resilience, College of Engineering at the University of Arkansas. And his presentation is a Consumer Food Security Nexus Framework. Dr. Kofi, are you there?
Yes, can you hear me?
Yes, I can hear you. Can you prep your slide, please?
Okay.
All right. The floor is yours. Please.
All right. Thank you. All right. So what I'm presenting is chapter 13 of the report, and this was put together by Emanuela Ellis, myself, and Professor Michael Ngadi from McGill University. And in this chapter, we are looking at a consumer food security nexus framework that would allow analysis of food systems resilience from a consumer perspective. And so this is the overview of the chapter. So first, we highlight the importance of a consumer focus in agri-food value chain assessment, and then we present a methodological framework for such an assessment. We go on to define a holistic framework for a consumer-centered value chain, and then a system for the selection of the criteria, indicators, and also the dimension for the performance assessment is also outlined within the chapter. And then the last part is we, based on this system, a method for assessment for each of the dimensions and how they're related to the dimensions of food security is also presented in the chapter. Right, so far, based on what we've heard and what we've seen, it's evident that COVID-19 has disrupted our food system. Now, these disruptions have shown significant impact on our progress on global agenda for food security, and particularly within our region. Now, if you look at this chart, you can see that prior to COVID, from 2016 to 2018, the food security crisis was, with regards to people who were affected, it was 108 in 2016. And by the time it got to 2019, it was already 133. So if you think about this broadly, that the Sustainable Development Agenda is to bring hunger to zero. But the trajectory shown here, that even from 2016 to 2019, we were not on a good trajectory. We were not doing better. And if you look at the distribution of these, the vulnerable people, we have a large share in Africa. If you look at this 2019 data, it shows 73 million were in Africa compared to the other region. Then in 2020, when we had the COVID, at the beginning, we still had about 135 million people who were facing food insecurity. Now, by the end of 2020, that number had almost doubled. And so here, it's important that as we find ways to optimize our effort to addressing food security issues and consumer needs, we need to accurately assess the value chain. Now, current frameworks that are used are mostly focused on the production stage and are not linked with consumer, who are obviously the end target of any functioning value chain. Although we agree that a hardcore economic consideration will be critical, the importance of a consumer-focused agri-food value chain assessment would be essential as we look beyond the COVID-19. So here, what we propose is a consumer-based value chain model, which is made up of the product, supply, and then also the demand chains. Now, the demand side would represent the consumption stage, which is emphasize the activities performed by the consumers after they purchase any product. And the demand side of the chain would then be focusing on some guidelines that could be used in evaluating how well the value chain meet the consumer preference and needs. Now, such information would be very useful in the product supply chain actors, such as the producers or the processors and the marketers. And the supply side will then focus on shaping and satisfying the and sustaining consumer needs. So if you look at this diagram, what we're saying here is that whilst we have already focused on the production and the processing and understanding the value chain, the people for who we produce the food, the consumers, ought to be considered in understanding the full scale of the value chain. Now, within this COVID time, it's very obvious that both the production and processing have been distracted. And so the impact on people, what consumers would want, is actually not considered or not captured in all the data that is being presented. So in what we're proposing that would give us a better understanding of our value chain, we are looking at this flow where we take the demand and purchasing decision of consumers, and then look at the characteristics and do a value assessment, and also what the preference and the trade-offs would be. Now, in that flow, from the side where we link it to the food security indicators, then we can now take those requirements and translate them into product feature, and those product feature then are translated into value chain actions, which those on the supply side can then take and deliver what would be of more value to the consumer. And so here, the diagram that we show here, which is the flow of activities, it can be categorized into 4 key steps if you put all of them together. The first one is for us to effectively capture what the consumer requirement would be, and then categorize this and connect it with the place of food security. But the second thing would be to translate that preference into something that can be measured, and then also what actions can be taken in order to meet those features. And then finally, we will then, based on that, come up with strategies that could be implemented at the supply side in order to meet what the consumers want. So if you put all of that together, what we've described, you would have a framework that looks like this, where you begin with the requirement and you categorize that into the five food security pillars: availability, accessibility, affordability, acceptability, and utilization. And with that, you can then take the individual dimensions and the individual factors under each of the dimension and then translate them into value chain action. So if you look in the chapter, if you have a chance to read, you would see that we highlight what potential actions can be grouped under availability that would meet what consumers require. And you can do that for all the different dimensions of food security. And based on that, we've also determined what would be the measurable indicators for each of these dimensions that would allow us to see whether we are actually meeting those requirements, and based on the action that have been identified. And eventually, we can categorize all the indicators into the performance criteria, and also categorize the criteria into the dimension from the supplier side. Now, we have used this to demonstrate what the value chain, a consumer-based value chain, would look like in Zambia. And based on the results, it indicates that at the moment, even before COVID, we were not necessarily meeting what the consumers wanted, but at a local level, there are no alternatives, and so they would go with what is available. But as we look to build a more resilient food system that takes into account not only providing food, but providing food that meets certain criteria from a nutrition point of view, from an environmental point of view, we're looking at production that also would be affordable, that would be acceptable to consumers, and at the end would meet the diverse preference of consumer and the nutritional needs over a long sustained period. So the take-home message here is that beyond COVID, we must start thinking about how do we evaluate our food value chain more holistically. That takes into account the consumers at different level of actions within the value chain. So with that, thank you.
Thank you so much, Dr. Kofi. And that is an excellent way to wrap up the series of presentations, giving you a sense of what is going on the social protection space and what has happened since the onset of the global pandemic, how we have viewed it, the kind of the types of data we've collected, and the inference and the insights that we've developed. Of course, informing us of the messages both for the public sector and private sector of what to do right now and also to prepare for the future. Ladies and gentlemen, right now we are transitioning into a panel discussion, and I would like to invite the following speakers or panelists to prep themselves ready. Dr. Ugo Gentilini, the Global Lead Social Protection at the World Bank, Professor Jean-Jacques Bonigaba Muhinda, the Regional Manager for East Africa at AGRA, the Alliance for Green Revolution in Africa, Mr. Elhaj Moma Thiam, Monitoring and Evaluation Manager, National Council for Development and Nutrition in Senegal, and of course, Dr. Fleur Valtese, Principal Researcher, Climate Change Economics at the Global Center on Adaptation. Would like to begin with Dr. Gentilini. I believe this is the order that we are going with. Dr. Gentilini, are you, okay, I see you there. Right. How should the conceptualization and delivery of social protection programs be reconsidered, especially in the context of COVID-19? You've heard what the presenters have shown us of the weaknesses and the potential for social protection to provide these safety nets in the face of shocks and stresses. Perhaps in the context of COVID-19, but even beyond that, for any future shocks and stresses, how should the conceptualization and delivery of social protection programs be reconsidered? Over to you.
Well, first of all, really, thank you for having me. A great pleasure to join you all. It's hard to add any sort of enlightening point after everything that we heard from this great panel. But in terms of design and delivery, maybe it's interesting to look at the overall direction that countries have taken during the crisis in relation to three key design choices. If we think of some of the big debates out there on, for example, targeting versus universality, it's very clear that programs have relaxed eligibility criteria. They have scaled up cash transfers at the rate that was pretty historical in magnitude, about 249% relative to pre-COVID levels. 11 countries went all the way towards providing cash to everyone in society. And of course, this expansion is visible in spending, which is about 4 times higher than in the Great Recession. So in a way, the direction of travel has been one towards universality. In terms of the debate on conditional versus unconditional transfers, countries have made programs more flexible and waived the co-responsibilities and work requirements like in Tanzania and Ghana. So there is this movement towards unconditional transfers. And on the other big debate on cash versus in kind, there has been certainly a wider use of cash, about 1.3 billion people receiving them, but also in kind remains significant, about 250 million people getting them, and in sub-Saharan Africa, about 1/3 of the 300 social assistance measures are provided in cash. So the question then is whether programs will return to their pre-crisis design equilibrium or not. And I think that for targeting and versus universal programs, it is possible that programs at some point may decline from their peak in coverage during the crisis, but may land at a level higher than the pre-COVID one. So, as we heard from the speakers, programs tended to reach both people and places that were previously uncovered: informal sector workers, urban areas, which is the case of 11 countries in Africa. So indeed, it's possible and in fact desirable that many of those temporary programs will be improved and integrated. And hence there is this process of looking at which programs will be integrated and how. On conditional versus unconditional transfers, I think I suspect there was already supportive evidence before the crisis that basic cash transfers can go quite far in terms of impacts, and that added layers of integration will need to consider both the extra benefits and the extra complexities from it. So also in this case, programs may reinstate in some cases conditionalities, but overall we may see more unconditional programs compared to pre-COVID times. And finally, on cash versus in kind, I think here we'll see also more cash, but in kind would probably still play an important role, in part because of the diversity and variable market conditions within countries, because of the political economy of reform, and because social protection system, I think, providing cash would still need to do a better job at programming in context of high inflation. Thank you.
Oh, thank you very much. I'd like to staying with this, and I agree with you that right now we have a very high level of coverage for the social protection, and the hope is that the equilibrium level is higher post-pandemic than pre-pandemic, and it also improves the sophistication in design and interventions, the more targeted interventions by state actors. So, Professor Muhinda, you're with AGRA and you're working in East Africa. I guess you're quite busy since you've been thrown in at the deep end since April when you joined AGRA. With the work you do on policy and state capability, what is needed, and what areas do you find can be enhanced in building the state capabilities for enhanced social protection? Maybe specifically about AGRA or in general. Over to you.
Very good. So thank you very much, Brother Araba, for having me today. Kindly confirm if you can hear me.
Yes, I can hear you loud and clear. Please carry on.
Very good. So that's very interesting. And this is actually a very good question. And actually this is going to be complementing some of the presentations done in the previous session. I think, from where I sit, that the design of efficient social protection program basically starts with the availability of quality data. The state capability that is required to generate good data to inform actually the design of evidence-based policy intervention is very critical. I just give an example here that without quality data on social classification, for instance, by income categories like Benjamin alluded to earlier on, it becomes very difficult actually to design and even implement interventions such as social protection and even other development programs. I speak from experience having worked with some of the social protection programs in Rwanda. Now, if I consider the perspective from my own organization, the Alliance for a Green Revolution, as you mentioned, our approach to strengthening state capability takes into account a number of areas. I will probably mention the key ones. First of all, we work with the government, the national government, and technical partners, and even donor partners in each of the countries of focus, to make sure that we have sector strategic plans in place that are well aligned with the vision of the country, and also which have, prioritized and costed investment plan. Somebody mentioned earlier on about the clarity of planning and prioritization. So this is very critical. If you get it wrong from the planning point of view, you won't be able to implement efficient programs. Point number two, we also focus on creating enabling environment. Again, this was mentioned earlier on, where we support government to make sure that we are flexible in terms of articulating alternative policy options, and also approve policy changes based on reliable and relevant evidence. COVID-19 showed us that if you're not flexible in terms of policy changes and policy making, you can, as a country, actually experience several challenges. So two more points here probably, and this speaks to, again, a point that Benjamin alluded to on sector coordination. As a continent organization, we work with other partners in the country, including the private sector, to make sure that we strengthen not only the intra-sector, but also the interministerial coordination, as well as strengthening key coordination platforms. We know, for instance, that social protection related intervention cut across several sector ministries. So there's no single government, ministry or entity that can efficiently implement a social protection program without proper coordination with the other sectors. And that speaks to the last point I wanted to mention to your question here, Araba, which is something we've been working with the country governments together, which is on the accountability and transparency in not only program design, but also program implementation. In this particular area, we really work with the national government, and we seek to support them to put in place mechanisms and systems, to recognize and appreciate the performance of their own sector ministries, but also the importance of working with others, planning together, implementing together, and accounting together. So without this type of mechanisms in place, it becomes quite difficult to land some of these interventions here. And to conclude, I believe that this is an approach, this approach that we're using currently to strengthening state capability applies not only to social protection program, but also to any other development program, because actually, targeting is very critical, and there's no way you can do efficient targeted programs without some of the instruments I've just discussed above. I'll stop here for now, and back to you, moderator.
Thank you very much. I think, so we've heard this, you need creativity, collaboration, cooperation across multiple ministries, of course, not just within the country, but outside, both national partners, international partners, civil society organizations, etc. It's quite complex, but it's good that we have a country representative here. So, Mr. Thiam, can you give us an example of the actions that were taken by the government of Senegal to mitigate the negative impacts of the pandemic on the most vulnerable in your country? And what lessons have you learned from this experience, or are you learning? Please unmute yourself. All right, the floor is yours.
Désolé, le micro est activé. Merci beaucoup de cette opportunité qui nous est offerte de partager l'expérience du Sénégal à travers les mesures qui ont été prises pour un peu contenir l'épidémie de la COVID-19. C'est assez intéressant de partager ces expériences au vu de toutes les analyses qui ont été faites et qui recoupent un peu tout ce qui a été fait ici et valide peut-être un certain nombre de perspectives et de pistes qui ont été explorées au Sénégal. Donc, je rappelle que le Sénégal a été impacté par la COVID-19 à partir du mois de mars 2020 et que les premières mesures ont commencé à être prises très rapidement à partir du 15 mars à différents niveaux. Il y a d'abord eu une réponse graduelle qui a porté d'abord sur le volet sécuritaire avec une réduction des déplacements, une réduction des regroupements à différents niveaux pour parer à la propagation de la pandémie. Et ensuite, le gouvernement a pris une série de mesures de façon concomitante parfois, ou alors de façon échelonnée, pour prévenir un peu l'impact négatif que cette pandémie aurait pu avoir au niveau des ménages, au niveau des individus et au niveau des entreprises. Ces mesures ont porté sur le plan de la fiscalité, où c'est principalement les entreprises du secteur formel qui ont été ciblés avec des mesures de réduction de la fiscalité, du poids de la fiscalité, des mesures d'ordre budgétaire au niveau du budget de l'État, où il y a eu un gel de certaines lignes budgétaires et une réallocation des montants correspondants vers des dépenses d'ordre social. Et c'est la 4e série de mesures qui a été prise avec l'affectation de plus de 50 milliards de francs CFA à l'acquisition de vivres et à la distribution de ces vivres d'urgence aux populations les plus vulnérables ou alors vivant dans les zones les plus vulnérables, et une série d'actions dans le secteur de la fourniture des biens sociaux comme l'électricité, comme l'eau, où l'État, de façon ponctuelle, a pris en charge un certain montant de l'électricité pour toutes les catégories de population. Il y a également un appui monétaire direct aux Sénégalais de l'extérieur et particulièrement aux étudiants sénégalais impactés par la COVID vivant à l'extérieur du pays. Et de façon globale, les disons, mesures qui ont été prises par l'État du Sénégal et des démembrements de l'État du Sénégal ont également pris des mesures en interne de façon spécifique pour appuyer certains secteurs, certaines catégories de population qu'ils avaient en charge, notamment sur le plan de la sécurité alimentaire, sur le plan de la nutrition, également des mesures ciblant les enfants défavorisés, vivant surtout en milieu urbain. Donc, toutes ces mesures ont permis d'avoir un impact sur la population, ont permis d'atténuer la crise que nous avons vécue et qui est multiforme due à la COVID-19, et un certain nombre de leçons sont à tirer de cela. Donc la première leçon déjà, et elle est positive, c'est que nous avons l'espace budgétaire pour pouvoir faire face à un certain nombre de crises en mobilisant des ressources en interne, mais en faisant également recours à d'autres partenaires. Mais nous avons l'espace budgétaire nécessaire et nous pouvons rationaliser les ressources pour pouvoir mettre en place des plans de contingence qui seraient financés principalement par les ressources internes. Deuxième enseignement, c'est que nous avons en place des mécanismes de filets sociaux, des mécanismes de régulation sociaux qui fonctionnent à l'épreuve et qui peuvent être mis à contribution pour faire face à la crise. Troisième leçon, il faut une réponse qui soit multiforme, qui soit multi-acteur et qui cible tous les segments de la population pour atténuer la crise. C'est quelque chose d'indispensable. Nous avons des points critiques, nous avons des secteurs qui sont les plus vulnérables. Toutefois, les autres catégories d'acteurs, même s'ils sont minoritaires, ne doivent pas être oubliés dans la réponse qui est engagée. Et dernière leçon qui a été tirée de la réponse à cette crise, c'est que la réponse est massive. La réponse doit être massive, la réponse doit venir de tous les secteurs, mais elle doit également être adaptée. Je donne l'exemple de la distribution massive de vivres aux différentes catégories de la population et particulièrement celles qui étaient vulnérables. Cette réponse n'a pas ciblé de façon précise une catégorie vulnérable parmi les plus vulnérables. C'est les ménages vulnérables qui étaient ciblés, mais les enfants dans la tranche d'âge de 0 à 5 ans, il n'y avait pas une réponse précise pour ces enfants-là dans le cadre de cette distribution alimentaire. Et c'est quelque chose qui, dans le contexte africain, dans le contexte particulièrement sénégalais, devrait être pris en compte avec un niveau de diversification alimentaire des enfants qui est particulièrement bas. Donc voilà un peu ce que je voulais partager avec vous en termes de réponse à la crise de la COVID-19 mise en œuvre au niveau du Sénégal et de leçons qui en ont été tirées. Merci.
Thank you very much, Mr. Thiam. Dr. Gentilini, I'm informed that you have to leave shortly. But before you do, perhaps we can get parting words from you. Now, in terms of the recommendations for social protection, we've heard a lot of presentations here, a lot of ideas, but each country's context is different. And so what guidance do you have for countries either making their way through designing new social protection programs now or strengthening existing ones? Do you have any general thoughts on messaging for them or the things that they should focus on to build a solid foundation and then they build up? Over to you.
Thank you very much. There is indeed a lot of diversity, as you mentioned, and I will point to 4 kind of cross-cutting issues that might be applicable across contexts. One is that regardless of kind of the type of programs provided, investments in social protection delivery systems pays off both in crisis and non-crisis times. It's very clear that countries that had better delivery systems fare better, and the response was faster and with higher coverage. And this includes investments in identification, enrollment, payment systems, communications, and by the way, this is a global agenda. We have seen also in a number of high-income countries glitches and challenges in delivery systems. The second, and I think it relates to what Professor Muhinda was alluding to, is the judicious use of technology. And I think there has been an incredible amount of learning over the past 18, 19 months. Countries that were able to reach people by setting up new delivery digital platforms in 10 days, like in Togo, or Morocco, that use different databases, and countries like Nigeria and DRC that use satellite images and establish partnerships with mobile phones companies to reach people living in informal urban settlements. So in a way, it's important to begin a sorting process on what to incorporate, what worked from a tech side in social protection, and how to improve it and manage possible issues of related to data privacy or exclusion. Then another point is that probably the best response is, of course, preparedness. And here I think there is a lot of learning that can happen from the climate agenda in connecting responses to early warning systems to scale up triggers and responses. So there is a whole agenda on how to connect that. I think we need to stress test social protection on a routine basis. We have recently launched a tool to do precisely that. I couldn't agree more with the calls for intersectoral collaborations. We have seen this was the case, for example, in a number of school feeding programs that altered their delivery mechanism and were delivered down to the doorstep of people's homes, and how that was done in combination with safety nets. I think is an interesting area to explore. And I think also the whole connection with external institutions and with humanitarian assistance in particular, it's important, and that we still know that about 3% of that assistance is not delivered through government structures, but there are a number of positive examples of convergence in Chad, in the Somali region, Mauritania, Nigeria. And finally, I think we should probably start to redefine what we mean by sustainability and trying to combine what is fiscal prudence, but also recognition of the fiscal multipliers that transfers generate. I think the work that Ben Davis and many others did vividly illustrate that cash transfers given to people is cash injected into the economy. So we should probably take that into consideration when we define sustainability. Thank you very much.
Couldn't have said that better. Thank you very much, Dr. Gentilini, and we thank you for your time. We wish you, shall we say, a profitable rest of your day. Dr. Fleur Valtese, now, Mr. Thiam, but just before Dr. Gentilini came on, Mr. Thiam, concluded by saying we need big, bold actions. I don't think anything can be bolder than the African Adaptation Acceleration Program, AAAP, that the Global Center on Adaptation and the African Development Bank recently launched. Now, my question to you is, based on what's been discussed, based on the presentations that we've seen, what social protection programs, in your opinion, have been most effective, and what kind of challenges have those programs faced in light of COVID-19? But more importantly, what do we need to do to build back? Well, shall we say build better? Not necessarily back, because a lot of these countries didn't even have social protection programs to begin with. But how do we build forward better? Based on what we already know now and what we're currently going through, in light of course, the ambitious programs and agenda that you've set out within the GCA in collaboration with AFDB. Over to you.
Okay, well, thank you. Good afternoon, everyone. So I was actually trying to approach this from a bit of a different angle, but I will come back a little bit to the AAAP. So I wanted to revisit the concept of institutional resilience that we discussed yesterday, that Professor Hendricks talked about. And during the COVID pandemic, we did a little bit of research to find out how resilient are rural institutions, in particular producer organizations and cooperatives. And what we saw is that there was actually quite a bit of initiatives that were taken by these organizations that we surveyed, primarily in East Africa, that were actually trying to protect their members from having their livelihoods destroyed due primarily to the restrictive measures on mobility, right? So mobility and trade, which made it very difficult for farmers to sell their produce, sometimes made it difficult for them to travel to their fields, and in general made life very complicated. So what we saw is that quite a few of these organizations were actually able to put in place measures to help members cope with the crisis. So what we found, for example, was that some organizations allowed members to withdraw some of their savings, right? So to have some cash available. There was organizations that allowed members to side sell their produce so that it wouldn't go, they wouldn't have to actually market through the cooperative. which also made it easier for them to kind of cope if they wanted to sell directly and not wait for the cooperatives to actually identify the market, etc. There were some organizations that actually helped their members identify new markets. So they were a little bit more active around information provision. And so those are some of the activities that we saw taking place in the field to help farmers cope. What was interesting, though, that those, although they could be considered to be social protection measures that were put in place spontaneously by these rural institutions, they did not actually do anything to protect the institution. So the measures that were put in place actually eroded some of the capacity of the institution to function. So if you think, for example, like allowing foresight selling or allowing members to withdraw their savings, those were measures that actually compromised the position, if you will, of the cooperative, of the organization. So what we kind of concluded from there was that these institutions clearly played a very important role for farmers. And this is something that we keep coming back to. And this also links already a little bit to, if you think about adaptation. Adaptation to climate change is also something that needs a very, very strong collective action dynamic, right? So I always like to refer to the situation, for example, in the Dust Bowl in the US in the 1930s, where there was this drought and farmers were individually putting in place measures to prevent this the soil from blowing off from their land. But then the farmer that put in place the measure would then get the sand from a farm that didn't. And that sand would actually cover their field and would actually destroy their harvest. So you see very easily how, if you want to cope with a climate shock, you would need to do that collectively. So we started to think, okay, so what we see is there is this function around social protection of these organizations. They play this pivotal role, of course. They have not been able, as we would have hoped, to really help farmers integrate into markets. That's still something that there is a lot of work that remains to be done. But there are two ways in which we would see that improvements could relatively easily be made to help these organizations function. And so what is interesting is that we found that these cooperatives and farmer-based organizations were not able to really put in place some type of transformative action, right? So they're helping the members cope, but they were not actually able to adapt or to put in place a new activity or to kind of transform, if you will, during that crisis. And so when we think about building back better, we have to say, okay, so why were they not able to kind of function as agents of change during that period? And one reason was, and which I found really interesting, is that they were not able to have physical gatherings, of course. And these organizations, they stand or fall, if you will, by in-person interaction, right? So these meetings are always called, actually are always physical gatherings of people. So this is clearly where digital could come in relatively easily, right? So you could say, okay, so if there is just kind of a tool or a platform or something put in place that would allow these organizations to meet virtually, that would already make a huge difference. And that is not something that is so far off, right, in our realm of possibilities, let's say. And then the second kind of finding was that there were specific characteristics of these organizations that made them more able to support their members. And some of those were really related to the level of what we started to call managerial capital that the organization was endowed with. And there's a lot of theory around that, of course, if you think about kind of institutional economists like Elinor Ostrom, where there is kind of a specific, and maybe more recently, Michael Cook from the University of Missouri, that have really started to think about, okay, so what do these organizations need to have in terms of capital to help them not only support their members, but also to help kind of their members have access to markets, if you will, and really become kind of a viable player within the food system. And so that managerial capital was lacking in many of these organizations. And this is something that we focused on quite a bit. So how can we actually then build the managerial capital? What kind of training could we provide to develop that capacity to help these organizations function better? So those are two of the directions that I would see us kind of intervening in, and they're also relatively straightforward. And so then to come back quickly to the AAAP, and in particular the climate smart digital technologies for agriculture and food security pillar that I still lead for a little while longer. There we've really focused on digital, but we've also really focused on how can we use digital technologies to kind of help decision making on the farm. So how can we use these digital technologies to help farmers adopt productive strategies for adaptation, and what role, how can we strengthen the cooperatives, farm-based organizations to actually support their farmers in that. And this is where, of course, the digital technologies would come in handy. So that's all from me. That's I hope it was not too far off the scale. Thank you.
No, thank you very much. I think you've got your hands quite busy wearing many hats within GCA. So it's good to hear your observations of what's happened, what you've observed over the course of the global pandemic. And it's interesting that you would mention the digitalization. I wanted to follow up with you, if you don't mind me bringing you back on. Now, I haven't heard much on digitalization and fintech, financial tools, and using that for access to financial support services. We're now seeing the growth of e-transactions, e-money. Central banks are even approving these now. Do you see a role for digital currencies playing a role to support social safety nets, especially for countries where moving physical cash around is a challenge? I remember seeing images in Nigeria where at the onset of the pandemic, people had to come to a place and receive cash physically. And the first thing I thought was, well, we're trying to encourage social distancing and prevent people from touching things, but yet here you are giving people physical cash to hold on to. And I live in Kenya. So living in Kenya and watching this in Nigeria, seeing the contrast where in Kenya, they reduced, as was done in Senegal, they reduced the tariff on mobile money transfers as an incentive to increase financial transactions. Do you see digitalization playing a role in improving access to cash transfers, or shall we call them financial transfers, because it won't be physical cash, it will be digital currencies or digital cash? Over to you.
Yes, and thank you for that. So I didn't get so much to the I focused much more on the kind of digital as allowing for better communication, let's say, and for better also organization. But I think that it's good that you mentioned the fintech. So what we've been really thinking about so far is kind of this bundling, right? So this kind of bringing different solutions under one kind of, portal, if you will. And so I guess that mobile money would also come in there. What we've been looking a lot at for the moment is mainly insurance. And so, of course, there's also a big role of digital there, and of course for mobile money. So what we try to see is really how can we get kind of an insurance program up and running that can really respond to farmers' needs, right? Respond to users' needs. And also, how can we kind of design it in such a way that it will gain traction? Because the uptake, of course, has been really problematic. So, what our approach is a little bit to kind of see how we can come to this bundled solution. So not only to then, for example, if you say insurance, to kind of help reduce the risk, let's say, of farmers to, for example, invest in an adaptation strategy, but then also to see, okay, so, but how can they then gain access to credit through the same portal, if you will, to then also carry out that investment. So that's definitely there.
Okay. Well, thank you very much, Dr. Balthasar. Professor Mohinder, are you still there?
I'm here, sir.
Wonderful, wonderful. So we've talked. I think we've done a deep dive into the public sector side of things. I wanted to touch a little bit on the research and private sector side of things. Of course, in your previous role, you were leading a regional agriculture research organization, but also you've had cause to engage with the private sector. What knowledge do you think the private sector, organized private sector at all levels, all the way from small scale farmers to large scale commercial, what lessons does the private sector need to learn from all this, and how can they be supported to ensure that they participate in enhancing these social protection mechanisms at national and subnational levels? Over to you.
Very good. So thank you very much, Dr. Araba. I think this is a broad question, but let me approach it from probably the food systems point of view, you know, not only being consistent with the conference theme, but also learning from what happened during this pandemic period. Now, in terms of the knowledge that private sector need, not only from you know, the research point of view, but also from the public sector interventions, I think is very critical. I mean, I've been looking at how, you know, during this pandemic period, really the base of the population pyramid was badly affected, you know, not being able to access services and goods that the private sector provide. I think one of the critical areas of learning for the private sector point of view is to try and see how, you know, the services and the goods they provide can reach as many people as possible. So this entails actually to come up for, you know, for investment companies, for different operators to come up with business models that are inclusive enough, that ensure that their product and services are accessible to the low-income population and the most vulnerable, you know, section of the population in particular. So that's point number one. Point number two, I think that in addition to the effort being done by the national government or the public sector globally, so colleagues have discussed the role of digitization. And I think this is an area that private sector operators and actors in general have to embrace very strongly. You know, during the pandemic, not only the consumers were affected, but also the businesses were affected. And you can see how different countries today are, you know, struggling to subsidize loans for the most affected small and medium businesses, and even other related measures that reduce vulnerability to external shocks in the area of trade and commodity prices. So embracing digital solutions along the value chain is very critical, and I believe the private sector has a lot of learning, you know, from what is going on broadly. So the other point probably that I would mention at this point from your question, Dr. Araba, is on the private sector participation, you know, all the way from, you know, policy making, policy implementation, and even accountability. So that actually requires, you know, completely to change the business models which different companies have been using before the pandemic, and come up with a different way of doing business, which is different from the business as usual. So I will probably stop here, but there's a lot of, and this is not a one way, you know, as we talk about learnings and learn knowledge from the private sector. So the other way around also applies, you know, there are so many things from the research point of view, from the public sector, that we can learn from the private sector actors in terms of optimizing operations and businesses as well. Over to you. Did you get me, Dr. Araba?
Can you hear me?
I can't.
Oh,
okay.
Yes.
Did you hear me?
Thank you. Yes, I did. Thank you very much, Professor Mahinda.
All right.
And as you said, you know, this is not just a public sector effort. This requires all partners. I think before I bring on Mr. Thiam for his thoughts on what's been discussed so far, I also wanted to ask the members of the audience, even though we've put it in the chat, you may not have noticed that if you have any questions, you could please type them in the Q&A chat box, and we will pose them to the speakers. So if you have any questions, please use the Q&A chat box and type in your questions. We will either respond to them during the session, or we will have the respective speakers respond to you in real time, even within the chat box as well. As we get into the sharp end of this session, I'd like to invite Mr. Thiam back on. I like the way you ended your opening remarks on big, bold interventions. So maybe my question to you is, what should we expect to see and hear from Senegal on how you build your support systems, not just as you respond to COVID-19, but as you strengthen systems for future shocks and stresses? Over to you. Mr. Thiam.
Merci de me passer à nouveau la parole. Je pense que oui. Est-ce que vous me recevez? Allô, est-ce que vous me recevez?
Oui, merci.
Oui.
Allô? Voilà, excusez-moi. Donc, je pense que nous avons aujourd'hui des acquis en termes de protection sociale au niveau du Sénégal. L'une des principaux enseignements de la crise que nous avons passée, de comment nous avons fonctionné jusqu'ici, c'est que, en fait, ces différents systèmes de protection sociale qui sont à différents niveaux, qui ciblent différents segments de la population, mais qui forcément ne couvrent pas tous les secteurs de la population et particulièrement ceux qui sont les plus vulnérables. J'en veux pour preuve que l'intervention que nous avons eue au niveau de la COVID, ciblant les entreprises ou des entrepreneurs indépendants, c'est forcément focalisé sur le secteur formel et beaucoup moins sur le secteur informel. Le principal enseignement aujourd'hui, ce serait de faire en sorte que le système de protection sociale puisse couvrir aussi bien le secteur formel que le secteur informel. C'est également de voir comment renforcer le design de toutes ces interventions, comme je l'ai dit tout à l'heure, pour pouvoir couvrir les plus vulnérables d'entre les vulnérables. Nous avons un système qui s'adresse de façon globale à la population générale, mais qui ne prend pas en compte certaines particularités et certains particularismes qui peuvent améliorer la protection de certains segments de la population. Donc, c'est vraiment pour nous ce les voies aujourd'hui qu'il faut explorer. Au-delà de cela, il y a le caractère multisectoriel de la protection sociale qui aujourd'hui a commencé à être pris en compte au niveau du Sénégal, mais qui ne l'est pas, disons, de façon totalement effective et qui devrait l'être pour avoir un système qui soit beaucoup plus performant. Ça suppose, bien entendu, de revoir le système en lui-même, d'analyser encore plus en profondeur et de façon spécifique sa performance lors des crises au niveau du Sénégal. Et c'est des chantiers sur lesquels le Sénégal est en train de travailler. Et cela suppose évidemment la prise en compte de mesures qui, comme vous l'avez dit, doivent être courageuses et aller vers une meilleure redistribution des profits que nous avons au niveau du pays. Je vous remercie. À vous.
Merci beaucoup.
Je ne sais pas si vous me recevez.
Thank you very much, Mr. Thiam. Oh, yes. Thank you very much, Mr. Thiam, for your intervention. And so to wrap this up, the big insight we got there, one of the insights is, as we focus on expanding the social protection in Senegal, they noticed that the impact or the intervention focused on the formal sector. This needs to be expanded into the informal sector. And that goes for every single country, not just in Africa, but around the world. I think we all experienced the shocks and stresses from the global pandemic in our personal lives. And so this is a pandemic that has touched every single person. I would like to express my sincere thanks to the panelists, and of course also to our excellent speakers who provided the framing keynote speeches at the beginning of this session. I thank you all for participating in this session. It's now my responsibility to hand this session back to Lai. I'm trying to, Dr. Are you there? I'm not sure who's here. Dr. Bataki, are you there?
You're handing over to Dr. Tekwano, I believe, from the program chair.
Yes.
Oh no. I am handing over to Dr. Bataki. Dr. Bataki,
I'm right here. Thank you, Dr. Arada.
Thank you.
Thank you, Mr. Chair of Plenary Session 3 for that exciting session. So now we are going to have a very short break of 5 minutes while we prepare to come back for the next plenary session 4 on measurement issues. Please, there is no need to sign out, just step away, get a glass of water, and we'll be right back in 5